Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone. Here we have strain. Some of you ask about the how we adjust and how we know our strain is correct or not. In this lecture, I am going to give some example and how we fix and how we found out this is wrong or right. So please, before you go and find the answer at the end of the lecture, first pause it and for yourself fix whatever you think it is wrong and you have to fix it. Pause it and even write it down and make sure you check everything. And at the end, we go together and find out how which one is correct and how we fix it. This is a patient with the chemotherapy and has done the strain echo as you can see here. First of all, which of this clip or strain in the 4, 3, and 2 is correct and is not correct? Which one is not correct, more accurate? Or and which spot and which segment, if is any of them is not correct, which spot and which segment we have to adjust it and how we have to adjust it. You have to move in, move out, exactly make clear how you fix each of those spot that is wrong. Here is in another modality or vendor machine. As you can see, is it looks like apical 2 strain. Is this correct or not? What about the strain pattern you see here? What abnormal finding you can see here? If it's not correct, what we have to do is, if is that image is not correct, view is not correct, or tracing is not correct, which one? If any of them, how you fix it? Here again another case, strain for chemotherapy. Is that pre-chemo baseline? They got it this strain. Which of them is not correct? Is that this strain is reliable? And in those cases, those view and strain is not correct. How we have to fix it? What we have to do? Exactly detail. Here is another technique for strain as interest area. You can see whole myocardium has been tracing and tracking. ROI is not just endocardium, it's whole myocardium. First of all, is this correct tracing and strain or not? Second, which spot, if it's not right, we have to fix it. Third, what is your landmark and criteria for selecting the width of the ROI? How much our ROI should be width? What is your landmark and standard for correct tracing if we use whole myocardium tracing? And on the chart, do you see any abnormal finding? Does this abnormal finding correspond with that spot you are going to fix it? It looks like it is a little off. Here is another case. Is this correct strain or not? How we have to fix it? Which spot if the view is correct or not, we have to, what should we do about each of those strain, each view, which spot should be fixed and how? Here another one, again we use whole myocardium for strain. Is that correct or not? How we have to fix it and what is abnormal finding on the chart, strain chart? And does that finding correspond with your abnormal or incorrect tracing? Here you get a case, bull's pattern for the strained longitudinal and for time to peak, longitudinal strain. how you interpretate this one, what the finding are in both of them, and what is differential diagnosis for this case. Here you have patient for the right ventricular free wall strain suspicious to pulmonary embolism, and the doctor ask for the right ventricular free wall strain and detect to this way. First of all, is that correct strain for RV focus view or not? If not, which spot or which segment or how we can fix that incorrect strain on this case. Now let's go and find out the correct answers.